Have you ever noticed that something which once felt simple and natural now feels different? Many men in their 60s and beyond quietly sense that their bodies no longer respond the same way they did decades ago. What once felt familiar may now bring a bit of uncertainty or even quiet concern. My name is Dr. James, and for many years I've worked closely with older men, helping them understand the changes that come with aging and how to care for their bodies with confidence and dignity. One question I hear often, though it is rarely spoken aloud, is about what happens inside the prostate when a man continues certain personal habits later in life. The truth is, many men over 60 are still following routines their bodies developed in younger years without realizing that the prostate itself has changed with age. In this video, I'll gently explain what's really happening inside the body and how small adjustments can help restore comfort, confidence, and a healthier connection with your own body. And there is one particular mistake many men unknowingly make, one that can quietly affect the prostate more than they realize. 1. Your prostate is still producing fluid, and daily release changes how it works. If you're a man in your 60s or 70s, you may have quietly noticed that your body no longer behaves the way it once did. Sensations change, recovery takes longer, and sometimes even the most private aspects of your health begin to feel unfamiliar. Many of the men who sit across from me in my clinic share a similar worry, though they rarely say it out loud. They wonder whether the habits they carried from their younger years are still safe for their bodies now, especially when it comes to the prostate. What many older men don't realize is that the prostate never truly stops working. Even well into your 70s and 80s, this small gland continues to produce fluid that becomes part of semen. That fluid doesn't simply disappear with age. It is constantly being made, stored, and eventually released during ejaculation. For some men, especially after retirement, when life becomes quieter and more reflective, these private moments may still happen regularly. Others may notice they occur less often as the years pass. Both situations are normal, but what matters is understanding what is happening inside the body. When ejaculation occurs regularly, the prostate releases the fluid it has produced and begins creating fresh fluid again. In many ways, this process allows the gland to renew itself, but when long stretches of time pass without release, that fluid can remain inside the prostate for extended periods. In some older men, this can contribute to a feeling of pelvic heaviness, mild discomfort, or the subtle anxiety that something inside the body is no longer functioning as it should. For a man over 60, these sensations can be unsettling. It's not just the physical change that worries him, it's the fear of what those changes might mean. Is it a sign of prostate enlargement? Could it be the beginning of inflammation? Is this simply part of aging or something that needs attention? These questions often linger quietly in the back of the mind. Understanding that the prostate is still actively producing fluid helps explain why the body may respond differently now than it did decades ago. And this leads us naturally to the next important point, because what happens when that fluid stays inside the gland too long may be more significant than many men realize. 2. Regular release helps the prostate empty and relieve internal pressure. As we just discussed, the prostate continues producing fluid throughout a man's life. But for men over 60, another important question naturally follows. What happens when that fluid sits inside the gland for too long? This is where many older men begin to notice subtle changes in their bodies, changes that can be confusing and sometimes quietly worrying. In my years caring for older patients across the United States, I have often heard men describe a vague pressure deep in the pelvis, a feeling that something is not quite right. Sometimes it appears as increased nighttime urination, a slower urinary stream, or a lingering heaviness that wasn't there decades earlier. These sensations can trigger a quiet fear that many men carry privately, the fear that their prostate may be enlarging or that something more serious might be developing. Part of what is happening relates to how the prostate manages the fluid it produces. When ejaculation occurs, the gland empties some of that fluid and reduces internal pressure within its small chambers. For many men, this release allows the prostate to reset its internal balance. But when long periods pass without release, especially in older age when the prostate naturally tends to enlarge, fluid can remain inside the gland longer than it once did. This doesn't mean that every man must maintain the same habits he had in his 40s or 50s. The body changes, and every person's situation is different. However, understanding this process can help explain why some men notice discomfort or a sense of fullness in the pelvic area. It is not always a sign of disease, but rather a reflection of how the prostate responds to aging. What matters most is awareness. If a man begins noticing persistent pelvic pressure, difficulty urinating, or changes that seem unusual for his body, that is a signal worth paying attention to. Sometimes small adjustments in lifestyle and routine can make a meaningful difference, and in other cases, it may simply be a reminder to speak with a trusted physician. And this leads us to the next important piece of the puzzle, because the prostate is not only affected by fluid accumulation. Another powerful factor, one many men underestimate, is the role that blood circulation plays in keeping prostate tissue healthy over time. 3. Better blood circulation can support an aging prostate. Once we understand that the prostate continues producing and storing fluid even later in life, the next important piece of the puzzle involves circulation. For men over 60, blood flow becomes one of the most important factors in how well tissues throughout the body continue to function. The prostate is no exception, like the heart, the brain, and the muscles. This gland depends on a steady supply of oxygen and nutrients delivered through healthy circulation. When that circulation slows with age, as it naturally tends to do, many men begin to notice subtle but unsettling changes in their bodies. Some of the men I see in my practice describe a quiet discomfort they can't quite explain. It might feel like mild pelvic pressure, a sense of heaviness, or a feeling that the lower part of the body is simply not as responsive as it used to be. Others become worried when they notice changes in urinary patterns or sensitivity. These experiences can trigger a deeper fear that something more serious may be developing, especially for men who have heard about prostate enlargement or cancer from friends, family members, or routine medical visits. One important factor behind many of these sensations is reduced blood circulation in the pelvic region. As men age, blood vessels naturally lose some of their elasticity. Conditions such as high blood pressure, diabetes, or a more sedentary lifestyle after retirement can further reduce circulation. When blood flow to the prostate and surrounding tissues becomes limited, the gland may not receive the same level of oxygen and nutrient support it once did. Over time, this can contribute to inflammation, congestion, and the uncomfortable symptoms many older men quietly worry about. However, certain natural body processes temporarily increase circulation to the pelvic region. During sexual arousal and ejaculation, blood flow rises significantly in this area. This increase in circulation can help nourish prostate tissue and support its normal function. It is not a cure for prostate disease, but it can be part of maintaining healthier tissue over time. Understanding this connection helps explain why the prostate sometimes responds differently depending on how often these circulatory changes occur, which leads us to another important question many older men rarely think to ask: how these repeated changes inside the gland may influence long-term prostate health. 4. What research suggests about ejaculation and prostate cancer risk? As we've just discussed, circulation plays an important role in the health of the prostate, but for many men over 60, the deeper worry often goes beyond discomfort or changes in sensation. The word that quietly sits in the back of their mind is cancer. In the United States, prostate cancer is one of the most commonly diagnosed cancers among older men, and many patients tell me that the fear of hearing those words during a routine checkup is something they carry silently for years. Because of that fear, men often start questioning everyday habits they once never thought twice about. They wonder whether something as private as masturbation might somehow increase their risk of prostate problems. Some men even stop certain behaviors entirely out of concern that they may be harming their bodies without realizing it. What surprises many of my patients is that the research over the past 2 decades has suggested something more nuanced. Large observational studies following thousands of men over many years have found that men who ejaculate more frequently throughout adulthood tend to show a slightly lower risk of developing prostate cancer later in life. Researchers believe this may be related to the way ejaculation helps move prostate fluid out of the gland. When fluid remains inside the prostate for long periods of time, certain metabolic byproducts may accumulate. Regular release appears to help clear some of those substances, allowing fresh fluid to replace what was stored. Now, it's important to approach this information with balance. Frequent ejaculation is not a guarantee against cancer, and it should never replace regular medical care. For men over 60 living in the United States, routine prostate screening, discussions with a physician, and awareness of symptoms remain the most important tools for protecting long-term health. At the same time, understanding that normal bodily functions are not inherently harmful can relieve a great deal of unnecessary anxiety. What I often tell my older patients is this: the prostate is not simply a passive organ waiting for disease to appear. It is an active gland responding to circulation, hormones, and the natural rhythms of the body. And when we begin to see the prostate in this way, another important question emerges, one that many men overlook: how inflammation inside this gland quietly develops over time, and what everyday habits may influence that process. 5. Regular release may help reduce inflammation inside the prostate. As we continue this conversation about prostate health, one topic that often worries men over 60, sometimes even more than cancer, is inflammation. Many older men across the United States quietly live with symptoms they rarely discuss openly: a dull pressure deep in the pelvis, a burning sensation when urinating, waking up several times at night to use the bathroom, or the unsettling feeling that something in the lower body just doesn't feel right anymore. These experiences are often linked to inflammation within the prostate, a condition that becomes increasingly common as men age. Inflammation can develop slowly over time. In the prostate, it may be influenced by several factors that tend to increase after retirement age: reduced circulation, less physical activity, metabolic conditions like diabetes, and simply the gradual aging of tissues. When fluid remains inside the prostate for long periods and circulation is not as strong as it once was, the gland may become more vulnerable to irritation. For some men, this irritation can contribute to prostatitis or worsen symptoms related to benign prostate enlargement. What many men find surprising is that regular ejaculation may play a small but meaningful role in reducing some of that internal congestion. When the prostate releases fluid periodically, it reduces the amount of fluid sitting within the gland and encourages fresh circulation through the tissue. This process may help limit the buildup of inflammatory compounds that can accumulate when fluid remains stagnant for extended periods. Of course, this does not mean that ejaculation is a treatment for prostate disease, and it should never replace medical care. But understanding this natural mechanism can help older men view their bodies with less fear and more awareness. Many of my patients tell me they spent years believing that certain private habits were harmful, only to learn later that the body often uses natural processes to maintain balance. For men over 60, the most helpful step is to remain attentive to the body's signals. Persistent pelvic pain, changes in urination, or discomfort should always be discussed with a healthcare professional. At the same time, recognizing that the prostate benefits from circulation and periodic release helps us understand another important piece of the puzzle. Because beyond fluid movement and inflammation, there is also the role of the muscles surrounding the prostate, which quietly support the gland's function throughout life. 6. The pelvic muscles around the prostate continue working even later in life. As we've been discussing, the prostate does not function alone. It is part of a small but very important network of muscles and tissues deep within the pelvis. For many men over 60, this is something they rarely think about until changes begin to appear. Perhaps weaker urinary control, slower response in the body, or the quiet frustration of feeling less connected to physical sensations than they once did. These experiences can create a sense that the body is slowly shutting down, and that thought alone can be deeply unsettling. What often surprises older men is that the muscles surrounding the prostate remain active throughout life. During ejaculation, these muscles contract in a rhythmic pattern that helps move fluid through the reproductive tract. It is a coordinated process involving the pelvic floor, the prostate itself, and nearby structures that support bladder and urinary function. In younger years, this process happens almost effortlessly, and most men never give it a second thought. However, as the body ages, Muscles throughout the body naturally lose some strength and elasticity. The pelvic floor is no different. Years of sitting more frequently, reduced physical activity after retirement, or conditions like diabetes and nerve changes can gradually weaken these muscles. When this happens, men may begin to notice subtle changes: less control when urinating, slower recovery after bladder emptying, or a feeling that the pelvic region simply does not feel as strong or stable as it once did. Regular muscular activity in this region, including the contractions that occur during ejaculation, can help keep these muscles engaged. While it is not a substitute for pelvic floor exercises or medical care, the natural movement involved in this process may help maintain coordination in the surrounding tissues. For older men, this is an important reminder that the body continues to rely on gentle activity to maintain function, even in areas we rarely talk about. What I often tell my patients in their 60s and 70s is this: aging does not mean the body stops working. It means the body works differently. Paying attention to circulation, muscle activity, and comfort in the pelvic region can make a meaningful difference in long-term prostate health. And this leads us to the final piece of the picture, because one of the most important factors influencing these changes is simply age itself and how the prostate evolves over time. 7. After 60, your prostate responds to these changes more than ever. As we come to this final point, it becomes clear that age itself quietly changes how the prostate responds to everything we've discussed. For men in their 60s, 70s, and beyond, the prostate naturally becomes more sensitive to circulation, fluid balance, and inflammation. Many older men begin to notice subtle signals: waking up more often at night to urinate, a slower urinary stream, or a lingering concern that something inside the body may not be working the way it once did. These changes can easily trigger fear, especially when prostate enlargement or cancer has affected friends or family members. But understanding how the prostate evolves with age allows you to approach these changes with awareness rather than anxiety. Paying attention to your body, maintaining regular checkups, and supporting healthy circulation and pelvic function can make a meaningful difference. And when we step back and look at the full picture, something reassuring begins to emerge about how the aging prostate can still be supported in simple, thoughtful ways. As we grow older, the body becomes more delicate, and the prostate quietly reflects those changes. Small shifts in circulation, muscle tone, and inflammation can influence how comfortable and confident a man feels in his own body. Understanding these changes is not about fear, it is about awareness. When men over 60 listen to their bodies, maintain regular medical checkups, and adjust their habits with care, they give themselves the best chance to stay healthy. Over the next 1 to 5 years, these small, thoughtful choices can make a meaningful difference in comfort, confidence, and long-term prostate health.